This Black History Month, we're looking at contributions African Americans have made in our communities, but we're also looking at issues that impact them. One of those, higher risks for serious conditions and diseases.
And as always, awareness is key and the first step to living a more healthy life. So Bridget is standing by now to ask a doctor about those conditions. We know there are certain risk factors that impact Black communities when it comes to health, not just genetics, but things like cost and access of care factor in as well. Joining us now to talk about these issues is Dr. Duron Lee, a physician at UCF Lake Nona Hospital. Good to see you again.
Good morning.
Well, you know, we talk about these issues that are very real, and some people may not even be aware just about these disparities in our communities when it comes to health.
Absolutely. In America, we have one of the best healthcare systems in the world. Unfortunately, there's a history of racial inequities within the healthcare system. African Americans still find themselves disadvantaged when compared to white counterparts and put them at risk for such diseases like heart disease, diabetes, hypertension, cancers, etc.
And there have been different findings about how it's impacting people in different age groups, such as Black people being affected at younger ages and developing these chronic illnesses sooner, dying sooner from those illnesses as well?
Absolutely. Black Americans find themselves with certain chronic diseases that other ethnicity and other populations find at older ages. So when it comes to heart disease is the #1 killer of all Americans, and it's actually been the rate has been steadily decreasing over the past 50 years. The rate hasn't been declining as fast with African Americans. We still find ourselves twice as likely to die from major cardiovascular events like a heart attack, and just overall all-cause mortality rates are increased for heart disease as well.
So, you know, we talk about the problem, we acknowledge the problem. So what is the multi-step plan to correct this? Because I think it will take generations, really.
Absolutely. There is a genetic component to some of these instances, but there are a lot of socioeconomic factors that play a role. Food insecurity, homelessness, poverty, unequal access to health care, smoking, obesity, inactivity. These challenges put us particularly at higher risk for developing these chronic diseases. One thing that we can do, prevention is always easier and more cost-effective than treating disease after the fact. So I encourage all Americans to be an advocate, be your own advocate for your health care. Ask questions, increase your medical literacy by asking your provider about questions regarding your medical condition and the treatment. Read a little bit about it. And more importantly, obtain a primary care physician, to establish your baseline medical health and obtain your annual exams, your preventive screening, like your blood pressure, your sugar, your cholesterol checks, as well as any age-related appropriate screenings like mammograms and colonoscopies, pap smears, etc.
You know, what can you say about the correlation between leaving a lot of these conditions untreated that happens many times? Like people know they have these conditions, but they're not taking the prescriptions or not getting those regular checkups. And I mean, this affects all people, but disproportionately in minority communities.
Absolutely. And there are a lot of factors that contribute to that. But at the end of the day, this is a matter of life or death. So really, I encourage patients to take an active role in their health. Reaching out to primary care providers, but also find other providers to support your emotional, your psychological, your mental, and spiritual health as well.
And when it comes to finding a doctor, that access to care factors in as well. Talk to us about that, because it is, it's hard to find someone. Sometimes it's hard to get appointments. People worry about the cost. So how do we combat that?
So at the end of the day, there is a shortage of primary care physicians in the country. But there are other health qualified professionals who can take the reins and help navigate you through this healthcare system. Nurse practitioners, other naturalists, holistic medicine doctors. So really, I just tell folks, find someone who can really guide you through this, through your healthcare.
When it comes to like these medications, when we look at prescription prices and things like that and being able to afford the medications, what can people do?
So that's always a challenge. Prescription medications are very expensive. I always encourage patients to ask their providers for the cheapest or cost-effective medications. There are generic medications that are available, and they are just as well as some of the brand names. There are prescription programs with pharmacies that you can look into. There are discount coupons as well. So it's really just kind of asking your provider for other options to try to help kind of negate some of the costs associated with some of these medications.
And I know we're seeing a lot more awareness building in the faith community as well, programs to kind of encourage more people to, take control of their health care and be more aware. Where can people read up more about these issues affecting Black communities and minority communities when it comes to health care?
Sure. The CDC is always a good resource. They have the most up-to-date information by qualified professionals, so I'll start there. The NIH is another resource for good information. And really, going to your community health center can be helpful as well. So those are options that you can kind of explore to get more information.
All right, thanks, doctor. Good to see you.
My pleasure.
And I'll send it back to you, ladies.
Bridget, thank you.